We were going to replace the mobile home, but then kind of life happened and we weren't able to do that, and it just kept getting worse and worse and worse and worse, and it was just a very depressing place to be after a while.
Curry County is at the end of the earth. It really is. It's a beautiful place right on the Northern California border and at the Pacific Ocean. It's hard to get there from anywhere. It's severely underemployed. The collapse of the logging industry in the early 90s has really hurt the county, and they haven't recovered.
So we've got a lot of people living in pretty old housing and in a very rugged, wind-torn, storm-ravaged part of the country.
Manufactured housing really has a lifespan to it, and some of it was never built to be permanent housing. The roofs get leaky, the windows are leaky, they're impossible to keep the damp out, impossible to keep warm in the winter and cool in the summer. People use wood to heat their homes, which is a major air quality concern in the state of Oregon, also a fire hazard.
Our health impact assessment identified a series of challenges facing owners of older manufactured homes. Things like disease vectors from rodent infestations to physical hazards, holes in the floor, unsafe electrical connections, mold and mildew and asbestos problems affecting indoor air quality.
When we pulled the data, what we noticed was that in terms of emergency room utilization, the highest rates of health conditions that we had in Curry were around respiratory conditions and falls.
One of the more surprising results was the real mental and emotional health challenges that come from living in a home like this.
They really clearly laid out the concerns of having folks live in substandard manufactured housing. And then a great opportunity, which is that the federal government provides funding for low-income people to allow repairs and replacements of homes that need energy upgrades. But the state of Oregon doesn't allow those monies to be used on manufactured housing. And there was a proposed pilot project to allow that in Curry County.
Our goal with this program is to replace a few homes, see how it goes, learn as much as we can about the challenges of manufactured home replacement, and then see if we can quantify some of the benefits to make this program sustainable and scalable.
Okay, this is where we're going to put our new place, where we took our old one down. We bought it 9 years ago. We can hear the ocean from here. I walk down to the beach every day. One thing that doesn't hurt me is walking. And we have the granddaughter. I take her down to the beach all summer long. We've had her since she was 2 months old, and we've got full custody of her. Her name is Sammy Nicole, which is named after her dad, was Sam, and Nicole is my youngest daughter.
Robert and Celeste are delightful and the most incredibly patient people too. They came to us and they were hoping that their home was repairable, and unfortunately it was not.
You know, it was a 1978 mobile home, and it was what it was, but it was nice, and it was a good size for us. It was just basically old and falling apart.
Yeah, we was having trouble with water leaks underneath the house. The old water lines were getting pinholes. It would put a soft spot in the floor, so we ended up having to replace a bunch of the floor. And then the other thing was the winters here would get the mold.
And Robert, being disabled, was getting to where he couldn't work on it anymore, so you have to call somebody in to get things fixed. And the home is very important, and it's a small community, and so I think it was just Robert and I would be, you know, okay, well, we can deal with this or whatever. But, you know, we have a child to think about. We wanted a nicer home for Sammy, too.
So manufactured housing has come a long way, and today you can get a very safe, decent, affordable, and durable house from a manufactured home builder. That said, we live in a very wet place. We really want these homes to hold up better than the ones they're replacing did. So we worked carefully with experts in the field to design a set of specifications tailored exactly for our coastal climate.
I was really impressed by the Manufactured Housing Association of Oregon. They hadn't thought about their design standards through the lens of health before. They hadn't thought about the concept of aging in place and people with wheelchairs and how that should impact the width of doors and the width of hallways. The HIA, for them, was an extraordinarily powerful tool because it truly influenced their design standards.
One of the key challenges is financing, and right now the banks don't understand manufactured housing. So each project gets put together a little bit differently with a different mix of funding and a different set of challenges. And it's just been so much fun to walk a few of these through, and I'm really excited about the ones that are coming up.
Arthur explained the program to us and the type of loans that were available, and so we got our application in, and it takes a long time. It took a long time because we were one of the first that were going to go through this type of funding and everything. So everybody that we dealt with was new at it, but we finally made it to the end. It was a long process, but we got it and it was worth it. We knew it was going to be worth it in the end, so we stuck with it. And we didn't have anything to lose, really.
Thanks to their patience and willingness to trust us and work with us, we got there, and now we have a tool that will help many other people.
And what I really liked about how this HIA unfolded was that we had home residents who were talking about their own personal experiences.
When you do an excellent project, when that project has a clear base in public health evidence, and it tells that story through the experiences of community members who are really impacted by the policy. It changes how people think about the work that they do. It changes what is possible in terms of fundraising. And it changes how policymakers make decisions.
There's so much shame that comes with poverty and housing conditions. And so I am so proud of the work that's resulted in families being able to live in a house that they feel proud of.
It's just going to be really emotional to know that we're getting a new house, and we feel really lucky that we are. It's going to be incredible because the old house was not a nice place to be. And it's going to be home, and it's going to be our home, and it's going to be nice to provide a nice place for Sammy to grow up in, you know, so she doesn't have to be in the old brown old home, the old trailer. I call it the old trailer.
It's here! Oh my gosh, our house is here! Oh my gosh, it's big! It's here, it's here!